Low back pain is an extremely common problem. I'm sure that every one of us would have had at least one episode of low back pain at some point or another. Now, this particular presentation is going to be primarily about chronic low back pain, meaning low back pain that tends to go on for months or sometimes years together. What to do? This is a two-part presentation, and the part that you're watching right now is the first part. Let's first get familiar with the structures of the lower spine, also called the lumbosacral spine. The spinal column, as you can see, extends from the skull up to the pelvis. The lower portion of this spinal column has what we call lumbar vertebrae and a sacral bone. There are 5 lumbar vertebrae, and below the 5th lumbar vertebra is the sacrum. This forms the lumbosacral spine or the lower back. Now these bones, of course, are supported on all sides by muscles, ligaments, and there are discs between the vertebrae. Now these structures will give shape to the spine, keep the spine stable, provide strength and support. So also for the spine to have its mobility, the structures around the spinal column are extremely important. Now, between the bones or the vertebrae are discs which are sponge-like in consistency, and they help provide flexibility to the spine. And keep in mind that the discs are there from top to bottom in the spinal column between the vertebrae. So they also act as shock absorbers. This is basically what you will need to remember to understand the issues that we come across with the lower back. What are the risk factors for low back pain? Some important ones are obesity, leading a sedentary life without much exercise, poor posture, and increased wear and tear, which happens in the metros of India quite often, and of course also in the rural India because of bad roads, in the cities because of long commute times, and riding on two-wheelers, auto rickshaws on the bad roads, staying on them for long periods of time. Also, psychological factors play a significant role in causing low back pain. Stress, anxiety, depression, they all play a role. Advancing age because of arthritis. Smoking is certainly a risk factor for developing low back pain. And occupational hazards. If a job involves constant heavy lifting, bending, and so on, certainly that can contribute to back pain. So what are the various causes of chronic low back pain? One is from arthritis. When the surfaces of the vertebrae, instead of being smooth, start getting rough, develop bone spurs, which in turn will lead to arthritic pain. Then again, if the intervertebral discs, which are the sponge-like structures between these vertebrae, if they start becoming drier, they are made up of 80% water. So if they start becoming dry, they'll shrivel, shrink, and the disc spaces will start getting narrower, causing pain and discomfort. Also, these discs may start bulging out. Now, keep in mind that the spinal column that you're seeing on the screen is actually holding the spinal cord. So the nerves are actually coming out at each level, and when these discs start bulging out, they are actually putting pressure on the nerves coming out of the spinal cord, which in turn can lead to pain, not just in the lower back but going down the legs. We've talked about the risk factors. All these risk factors, either alone or in combination, can hasten the wear and tear in the vertebrae and the discs, in turn leading to pain and other problems. Also, this The presence of risk factors means that there is more pressure, more strain on the back muscles and ligaments. Not only is there damage happening to the vertebrae and the discs, the muscles and ligaments are also being affected, which in turn can exacerbate the pain. So the various symptoms that we're going to talk about in the following slides are as a result of these mechanisms. In this picture, we are seeing how lower back pain typically develops. You see on top the normal disc, the very first disc in the picture in the center. Then next, right below that is a degenerating disc. The disc is starting to lose its shape and structure. Below that is a bulging disc starting to slowly bulge out. Then a herniated or prolapsed disc, meaning the disc has come out so much that it is now starting to compress or pinch a nerve. Then you see a thinning disc, and below that you see the bone surface is starting to get rough, bone spurs developing, which of course means that arthritis is starting to develop, and certainly the disc space has gotten very narrow, and all these contribute to pain. So what are the common causes of low back pain? Muscle tightness or muscle spasm. We've talked about bone spurs leading to arthritis. Disc problems we've talked about. Bulging discs, prolapsed disc causing compression or pinching of a nerve root. Certainly infections, there are certain types of infections which can cause low back pain by affecting various structures in the lower back. Osteoporosis. Osteoporosis is a condition when the bones start becoming thinner. They start losing their architecture, normal architecture, and they tend to break easily. This can also affect the lower back, leading to pain. And if you've had back surgery in the past, then certainly there is a chance for developing arthritis leading to pain. Diabetes can certainly cause low back pain through various mechanisms. Cancer is also one important cause for lower back pain. Now, there are some important signs that you will need to keep in mind. These we call danger signs or danger signals. If they are present, it means that action will need to be taken immediately. If you develop weakness in one or both legs suddenly, if you start experiencing sudden loss of sensation or numbness in the buttocks, or bladder or bowel incontinence, meaning no control over urination or bowel movements. If there is sudden excruciating pain in one or both legs over and above what you normally experience. If there is severe localized pain over the lower spine in one spot or in a small area of the lower spine. They are important danger signals that there is something serious going on. The concern that we have in these situations is that there might be compression of the spinal cord, which if not taken care of immediately can lead to catastrophic consequences. So let's talk about sciatica briefly. What exactly is it? Sciatic nerve is basically a large nerve that comes out of the lower spine on each side and goes into the legs on both sides. Now, this large nerve, when it is compressed by a ruptured prolapsed disc in the lower spine, we call it sciatica. Basically, this sciatic nerve is getting pinched by a prolapsed disc against the spine. The pain from sciatica is usually felt in the buttock on the affected side and the back of that leg, and typically it affects one side. The pain can be quite intense associated with numbness, weakness in the affected leg, and sometimes tingling or electric shock like sensation. As you can see in this picture, the nerve is coming out of the lower spine, and it's getting pinched. On the right hand side you see the nerve depicted in red color, getting pinched, and the location of the pain is also shown in this picture. In the buttock, back of the leg, back of the thigh, going into the foot. Now there is a term that we commonly use in India called lumbar spondylosis, or just spondylosis. This is basically nothing but a combination of arthritis in the lower spine with bone spurs, degenerating discs, bulging discs, and so on. What are the common symptoms of this condition? Of course, lower back pain, morning stiffness, especially upon first getting up, back feels very stiff. Sometimes pain or electric shock like sensation, or tingling shooting down into one or both legs, tingling and numbness, pain worsening with prolonged standing or walking, relieved by sitting down or resting. One or more of these symptoms. Now typically they tend to last for some time, going on for months, or for some people even years, with a waxing waning pattern. Sometimes symptoms are more intense, more noticeable, and other times they are quite manageable. This is it for this part, and in part 2 of this presentation we will talk about the management of lower back pain, and also briefly about various medicines that are available for treating low back pain.